Dr. Lee, you're a medical doctor from California.
Right.
And we're sitting here in Washington, D.C. at the moment. After reviewing that video, or after seeing that video, what is your opinion? Can it in any way relate to water fluoridation, or is it exclusively a pollution video?
I relate it to water fluoridation several ways. What I see in the video is that the fluoride that has come from this industrial source is contaminating the environment, and we can see that it affects various stages of the environment. The vegetation was affected, the animals that eat the vegetation, it was something to see that. And man cannot hold himself apart from that. It's going to affect his internal environment eventually too. And he's going to have the same set of reactions that happened to those cattle, for instance. So I don't see that man can hold himself separate from that. And also we see the damage to the teeth is obviously what is called fluorosis in the humans. And when they first started fluoridating, they were content that the 1 milligram per liter in the water would only cause a minimal amount of slight fluorosis. But now they're seeing that the fluorosis is increased in fluoridated cities. The school children now have 20 or 30% of them will have the disfiguring form of fluorosis. So it's obvious that there is a fluoride contamination for us now.
Well, that picture you saw of, a colored picture you saw of dental fluorosis, would you like to comment on that? Is there anything?
Well, I think the remarkable thing about that picture, which was taken by Dr. Cohone, who was the chief dental officer in the Auckland, New Zealand, right? Those children were receiving what was thought to be the optimal amount of fluoridation in the water, that 1 milligram per liter, which was, we are told, is safe. Those children were receiving that dose, and yet they are getting this disfiguring fluorosis.
Mm-hmm. Well, and also you're now familiar, or the people are now familiar with skeletal fluorosis, which was showing up in India. They say these people were getting very high concentrations in the water, and that couldn't relate to us at all. Would you comment on that?
Right. I've had a chance to review some of those, and there are hundreds of villages, thousands perhaps, that are involved in this, and there's a huge study going on in India of this because of the great disability and the loss of manpower that this reflects for the country. And the studies show that there are some villages that might have 3 or 4 milligrams per liter, but many of the villages had 1 or less than 1 milligram, 7/10 of a milligram, lower than the recommended dose here, and yet they were getting these skeletal fluorosis. The dogs in the communities got the skeletal fluorosis just from lapping up the same water.
So, and we also have some of our water supplies are quite mineral deficient, and they wouldn't have the buffering agents in their water either, would they?
Let me tell you what I see in practice. I see people with stiffness of their joints, with pain in their joints, stiffness in the morning, going around. I see the patients' x-rays, and there are extra calcium deposits in there. And you know what happens in our country? They receive a different diagnosis. Yeah. Different rheumatologists and different orthopedists. They will call it by some anatomical or x-ray appearance. They will make up a diagnosis for that. None of my patients received the diagnosis of osteoporosis or osteosclerosis, even though they've got the same thing happening.
But in your training, did you get any training on the effects of fluoride in your medical school, when you're going to school?
Not a bit.
Well, maybe that's where our problem is.
That's what our problem is.
It makes your problem. So what you saw with those cattle limping around there, it could be a...
We were taught in medical school that the fluoride at this 1 milligram per liter, 1 milligram a day dose had no toxicity. We were taught that this was perfectly safe. Now, since 1972 that I've had a chance to look into these studies, and I found that it wasn't true then, and it's certainly not true now, especially when our dose of fluoride is more than just the water. We're now getting it from the toothpaste and the food chain, and it's accumulating in us, and of course it's toxic. In fact, I believe now that there probably is no safe dose of fluoride.
Well, they mentioned that in the report there, but they also, the narrator referred to the National Research Council of Canada,
yes.
A study done by Dr. Rose and John Marriott,
yes.
And they said that they found dermatological, gastrointestinal, and neurological symptoms in 1% of people getting an exposure of 1 to 1.2 milligrams.
I recall the study,
Yeah.
and on this particular study, they chose young children and young mothers. And this should be the healthiest population, because if they are ingesting this fluoride, you'd think that their skeleton, with the tremendous number of available fluoride binding sites, would be the most protected of all people. The growing children have more binding sites for fluoride, which in effect removes it from the toxic effects elsewhere in the body. And yet they found 1% of them had these effects. And as you mentioned, they were neurological and they were gastrointestinal. And I see these in practice all the time. And they receive a different diagnosis, depending on what patient. Now, if you take someone who's older, and his skeletal or her skeletal binding sites are totally saturated, that same dose of fluoride taken each day will undoubtedly be more toxic.
Well, isn't that 1 milligram the recommended daily dose again?
That's the recommended daily dose, but the people are receiving more and more through their total daily intake.
Well, these symptoms of dermatitis and neurological symptoms, is there a possibility that those would not persist, but maybe gastrointestinal symptom would persist in these?
Yeah, that's true. I think people, if there's enough people who have the same symptom, they'll probably quit complaining about it. And everybody is over-fluoridated. And they may feel that it's something that they just have to live with. They may feel it's something in their diet. They may feel that they have to take a little antacid. And you know, most of the antacids are aluminum hydroxide. It works very well to bind up the fluoride, but aluminum itself may have some toxicity.
So that video does relate to water fluoridation?
Oh, absolutely. I don't think anyone can see the video without having the thought cross their mind. And they're putting that in our water?
Doesn't make sense, does it?
To me.
Thank you very much, Dr. Lee.
Thank you.
Very much appreciate that.
My name is Dr. John Lee. I'm a physician from Mill Valley, California. I am here in Washington, D.C. to make a presentation to the Environmental Protection Agency concerning the problems with the concept of fluoridation. I've been interested in this since 1972, when I was assigned the project by the Medical Society to investigate the pros and cons of fluoridation. I would like to show you some of the scientific information I brought to the EPA for their consideration, and it concerns the effectiveness of fluoride, or lack of it, and it concerns the problem of toxicity, a problem that was not recognized when fluoridation was first introduced. On these particular graphs, we see what appears at first to be a complex graph. It was prepared by Dr. Cahoon of Auckland, New Zealand. He was the Chief Dental Officer for New Zealand, and this graph covers approximately a 60-year period. The dotted line that goes from the top left to the bottom right represents a gradual decline in the cavity rate in 5-year-old children in New Zealand. It started rather high. In 1925, they had a mouthful of cavities, over 12 cavities per child. As time went on, there was a gradual decline in the cavity rate, so that in 1980, the cavity rate was only approximately 3 cavities per child. The decline that we see was accurately recorded because in New Zealand they had a very high number of children who were examined by the school dental service. The school dental service approached 100% in their examinations by the mid-1950s. That is this line. So therefore we know that this line is an accurate reproduction of the cavity rate in children who were 5-year-old for those years. This line represents the advent of fluoridation in New Zealand, which occurred in approximately 1965, at which time over 50% of the children became fluoridated. Now, if fluoridation were effective to reduce cavities, one would expect to see 5 years later a significant reduction in the cavities. That is, a precipitous drop in the cavities would occur 5 years after the introduction of fluoridation in these 5-year-old children. What we see in fact, is a mere continuation of the same decline. In fact, 5 years later, there's an actual leveling off, which could be interpreted to show that fluoridation not only did no good, but may have actually impaired the improvement that had been going on for the previous 40 years. The absence of a decline in this line shows that fluoridation was ineffective in changing the cavity rate in children. I would like to show you some that graphs and exhibits that explain fluoride toxicity. Not many doctors know that fluoride is as toxic as it is. The mechanism of toxicity is now well known. There are three mechanisms. Fluoride avidly replaces the hydroxyl radical in all biological systems. It avidly bonds to minerals, which in their free ionized state are necessary as enzyme catalysts, and it interrupts the normal hydrogen bonds in amino acids and nucleic acids, that is, in enzymes and in the DNA of your chromosomes. It is interesting to note that the mechanism of action of the supposed benefit of fluoride has now been totally confused, and there is no known mechanism of benefit. The mechanism of toxicity is well known. For example, this graph represents 6 patients with an odd condition called Gilbert's syndrome or Gilbert's disease. This line represents the serum bilirubin level, and this line indicates the passage of time in months. The people with Gilbert's syndrome have an elevated bilirubin, which in 1972 was found to be due to the inadequacy of a single enzyme, glucuronal transferase. This is a constitutional or inherited disorder, and these people live their lives with a modest amount of bilirubin, higher than normal, in their blood. This causes them to be slightly jaundiced on and off throughout their life. Since fluoride inhibits enzymes, it occurred to me that perhaps, since they were now living in a fluoridated community, that if we were to change over to unfluoridated water, the enzyme may have a better activity and might reduce their bilirubin levels in the blood. As you can see, when they changed from fluoridated water to unfluoridated water, the bilirubin levels in all 6 returned to normal within 3 months. Some might argue that the decline was a coincidence, and therefore one of my patients volunteered to undertake an experiment. His bilirubin was followed for a period of months. It remained elevated. When he was switched to unfluoridated water, for a short time, 6 weeks, his bilirubin fell. When he resumed the fluoridated water, his bilirubin rose. When he returned to the unfluoridated water, it fell towards normal. Another test showed that it rose with fluoride. And finally, when he stayed on the unfluoridated water, his bilirubin returned to normal, indicating that the enzyme glucuronal transferase was functioning better than it had before. The only thing that had changed was that we had changed his drinking water from fluoridated to unfluoridated. This shows that fluoride is toxic to enzymes. This shows that we might use this particular disease as a warning mechanism in society. When Gilbert syndrome becomes evident in a community and can be corrected by reducing the fluoride in the water, it is probably true that all of us should be drinking the unfluoridated water, because we all have thousands of enzymes and they cannot be monitored as they can in Gilbert syndrome. People have asked me, if fluoridation is as toxic as you say it is, why don't we see its effect? Where are all the bodies? There was quite a large epidemiological study conducted by Dr. Erickson of the CDC. What he did was choose 24 cities that were fluoridated, 22 cities were unfluoridated. The total population of these cities is 27 million people, which represents 1/10 of the population of the United States. He examined the death certificates for the year 1970, a census year. From that, he could calculate the death rates in those communities. What he found was that after adjusting for age, race, and sex, he found that deaths were 4.9% higher in the fluoridated communities. These were clustered in 3 major groups. GI cancer, such as cancer of the colon, was 8.8% higher. That is, the death rate of colon cancer was higher in the fluoridated communities. The death rate of heart disease was 12.25% higher in the fluoridated communities. A category called flu and pneumonia was 9.7% higher. If we look just at the heart disease death rate, we know that in the United States, the number of deaths annually due to heart disease total approximately 900,000 to 1,000,000 deaths per year. An increase of 12.25% would mean an increase of over 100,000 deaths a year if we were to compare a fluoridated United States with an unfluoridated United States. The deaths do occur, the bodies are there, they are mislabeled. The mislabeling is not a fault of the doctors, because the doctor who is caring for these patients, who nevertheless die from their colon cancer, their heart disease, their flu and pneumonia, that doctor would not know that fluoride was a contributor to the deaths. The diagnosis is merely a description of the organ dysfunction. The diagnosis is not a statement of etiology. This slide represents an accurate description of the effect of fluoride on bone fractures in women. There have been some claims made that fluoride should cause bones to be stronger. Dr. Sowers at the University of Ohio measured the incidence of fractures in several communities in Ohio. When she compared the fluoridated communities with the unfluoridated communities, she found that in the younger age group, it was approximately 3% greater. The incidence of fracture was 3% higher in the fluoridated group, and when they were older, the fracture rate in the fluoridated cities was 45%, and in the unfluoridated cities was 35%, almost a 10% increase. Correction, almost a 30% increase in the fluoridated cities. These groups of women were chosen as equal in all other regards. These are absolutely comparable groups of women, similar age, similar lifestyles, cigarette smoking, and so on. The fact that they were fluoridated is the only variable that is different, and we see that the fracture rate increased. I also showed the scientists at the EPA this list of references. This list of references are the sum total of the references in the scientific literature that relate osteoporosis to fluoridation status. This represents a public health report in 1965, another one in 1969, and another one in 1983. All of them show there is no benefit from fluoridation in the incidence of osteoporotic fractures. There are another group which are related to research, excellent research done in Finland. 1, 2, 3, 4. They all show the same thing. Fluoridation does not protect against osteoporotic fractures. Here is a study from China which finds that if you scan populations for osteoporosis, you find that early osteoporosis is a cardinal sign of excess fluoridation in the water. And this is Dr. Sauer's, whose research was indicated on the last slide. To encourage people to put fluoride in their water supply as a protection against osteoporotic fractures is irresponsible, it is false, and if it is deliberate, it is fraud. Fluoridation should not be in our water. It is not beneficial to the teeth, and it is toxic. Thank you.